Thank you all so much for having me today, too. My name is Elise Foss-Knight. I'm a PA, a physician assistant. I've been a PA for 10 years. And when I was in PA school, the love and my passion for sexual health really started to develop, recognizing that we weren't having these conversations and that we really needed to. And that if we think about our activities of daily living, sexual health and sexual function actually falls into those ADLs. And so really making sure that we're having those conversations. So one of the first things that I want you all to do that are actually here today is I know that this is a very vulnerable topic. And so just being here and listening, I want you all to pat yourself on the back and give yourself kudos. There you go. Yeah. To do that, because right in our country, sexual health is such a taboo and stigmatized conversation. We don't want to talk about it, let alone the pleasure piece of it. So, being able to have those conversations, especially as a healthcare provider, is going to be really important. When I first started out in urology, so that's kind of how I got into sexual medicine, is sexual medicine actually falls under the specialty of urology. We would think that it would fall under urology for men, and then it would fall under GYN, gynecology for women, but it really doesn't. It all kind of falls under that urology spectrum. So that's kind of how I got into that urology field. And again, just recognize that we weren't having these conversations, but people were wanting to have these conversations. So it was probably a couple of years ago that I had one of my patients plant a seed and said, "What do you want to do when you grow up?" And I said, "That's a really good question." I, again, recognized that we were just lacking kind of a center for sexual health. And so that's kind of where the Foss-Knight Center for Sexual Health kind of developed. And we actually opened up June of 2020. So we've only been open for about 16, almost 17 months at this point, right? No, nothing like opening up a business in the middle of a pandemic. But I had been working on this for 3 or 4 years at that point, and nothing was going to stop me. And I've been very honored that we have been so welcoming in the community in the Asheville area, that people are wanting these services. We are busy, which is very, very exciting. And that helps me to understand that there was a big need to have these conversations. When we talk about sexual health, it's more than just kind of genitals, right? It's more of the pelvis, how the pelvis is functioning too. And so those are the types of things that we're going to kind of bring up today, and how chronic illness, especially with Parkinson's, really impacts that sexual functioning, especially with your partner and the relationship as well. I do want to remind everybody that we do have the chat that you can pop questions in. I want to make sure that we give plenty of time at the end for questions. And I recognize too that some of these questions might be embarrassing, or you don't want to bring it up in the group. So in that chat feature where it says everyone, you can always click that down arrow and click on my name and send me a question or a comment separately, privately, so that, again, the whole group doesn't necessarily have to know about it as well. And by all means, I want to make this pretty interactive too. So if I'm on a slide, and you've got questions about something, I want to make sure that we stop and we can talk about it then. So just unmute yourself and say just say, "Elise, I have a question," and we'll stop and talk about it. I like more of those interactive pieces. So awesome. Well, let's go ahead and get started. I talked a little bit about myself. My practice, again, is located in Asheville, North Carolina. And there we go. All righty. So one of the first things, anytime that I have a talk or presentation in front of community members or organizations, is I always like to look at definitions. And we start thinking about, when I say sexual health, what is kind of that first thing that pops into your mind? And that can mean intimacy, that can mean connection, that can mean love. It can mean the libido, or the desire that you have to be with somebody or to be with yourself. Sexual health also means arousal. So it's all of that blood flow that goes to those genitals to make erections happen, or the clitoris get engorged with blood, in order for then orgasm to happen too. So when we think about the sexual response cycle, these are the types of things that are happening. We have desire in the beginning, then we have some arousal, then we reach a threshold, which gets us to orgasm, and then kind of resolution, because as much fun as it would be to stay in orgasmic bliss forever, life still has to go on. We still have to do things. So we have that resolution time frame also. So that's kind of what I mean when we start talking about, again, kind of the definitions of sexual health and what does it mean for you. So one of the things that I want to challenge some of you all throughout this whole process and this presentation is to keep that in the back of your head. What does sexual health mean to me? What is sexuality? What am I looking for when it comes to that connection and that intimacy as well? So I know that a lot of you are very familiar with Parkinson's and what that is, but I wanted to just quickly kind of go over that too, because it's important to understand how this whole process happens in relationship to then sexual health and sexual functioning. When we think about the central nervous system and Parkinson's, right, it affects a lot of the movement that's happening within our body. And a lot of times those movements are very uncontrolled. So there may be stiffness, there could be uncontrolled shaking, or even just difficulty moving. And that key player and that key hormone is going to be dopamine. And when we think about dopamine in the sexual response cycle, dopamine helps us to be interested in sex, to have bonds with somebody else. It's a positive player in sexual functioning. For those that have Parkinson's, we know that that's a lack of dopamine. So just not having dopamine in your nervous system to begin with means that may lower your response to sexual arousal. That may lower your response in having more desire. Again, thinking about that sort of thing too, when we're talking about sexual functioning, is how exactly is Parkinson's tied to it? And this is one of the key players that we think about there also. So again, when we think about, again, not having enough dopamine, right, it's going to be as far as motion and movement, that Parkinsonial type of reaction that we see there. And that can also then, not having enough dopamine, right, leads us to that lack of emotion. We can't maybe respond as well. And when we're looking for that within our partner and a response to our partner, that may be something that we're lacking there also. And then what happens, another chemical process in our body that happens if we don't have enough dopamine, it tries to replace that. And the chemical that it tries to replace that with is a chemical called prolactin. Prolactin we see for those that are breastfeeding. That's a main hormone for that, to stimulate milk production, to feed babies. But when we have increases of prolactin in those that are women, that can decrease arousability. It may stop their menstrual cycles from happening. But for men, when prolactin increases, that can lead to more erectile dysfunctions and inability to attain and maintain those erections. And then obviously we know, and what's really important when we talk about medications, right? We don't want to have an excess of dopamine either. And you all can see that here, the different things that excessive dopamine can actually lead to as well. So let's go ahead and just keep moving right along. When we think about all of the things that are involved with Parkinson's, all of these types of things then are involved with the sexual functioning too. So if we kind of go around and think about, again, all of these circles, Parkinson's is, again, right here in the middle. Again, when we think about the sensory types of things and how our body inputs information, especially on that sexual side of things, the loss of smell, we know that pheromones, from how our partner emits. The pheromones can be how somebody smells, how somebody tastes, all of those types of things. If we've lost that ability, then that connection that we have with our other person gets blocked a lot of times. And then we know, again, some visual changes can happen too. So if we can't see our partner as well, or can't see the room, or see safety, that's the other thing to think about there too. We've talked a lot about the movement piece of that too. So if you're used to being in some sexual position or being able to move with your partner, when that ability gets diminished, that connection then gets lost a lot of times too. There's a huge emotional component to it also, especially when you're not able to function as well as you would like to. Obviously, we see a lot of anxiety, a lot of nervousness, a lot of depression and mood changes that go with that as well. On the cognitive side of things, sometimes impaired judgment happens too, and then identity confusion as well happens. And then energy, right? So there's a lot of fatigue that goes along with this. So if you don't have enough energy just to function on a daily basis, sexual interaction takes a lot of energy too. And so when we think about where our energy wants to go for that day, and maybe we just want to be able to walk around and do a little bit of exercise. And so again, being able to think about, again, how that impacts the sexual functioning as well. Sleep is going to be a big one too, a lot of loss of sleep. Sleep is really important to refuel yourself, which goes along with that energy level too. So that's another big combination. And then again, autonomic. Autonomic is going to be a really big one too. Again, when we talk about, we see that sexual functioning is here, but it also is more in that pelvis of what's going on. So constipation can happen. When constipation happens and we have fullness of those bowels, it puts pressure on then the bladder. We may see increased urination. We also see dysfunctional voiding when it comes to the bladder also. So it may mean that you have increased urination or loss of function. So there may be incontinence or leakage that happens. And sometimes that can be very embarrassing if we're thinking about engaging in genital play with our partner, that we are thinking about our bowel habits and our bladder function as well. Sweating also can happen there too. And then obviously temperature regulation as well. So again, all of that too. So identity confusion, somebody had asked a question about that, of again, who you are and what your relationship with is somebody as well. So that may be very difficult sometimes with having a connection. If you are the caregiver with somebody who has Parkinson's or the partner of somebody who has Parkinson's, they may forget who they are and their relationship to a partner. So I hope that helps. If I need to clarify more, please let me know. Okay. So then big questions, right? So how does this all, again, impact the part of sexual health and sexual function? So again, sexual concerns are a huge common problem that we see with those individuals that not only have Parkinson's, but for those partners as well. Up to 80 to 90% of Parkinson's patients have complained about some sort of sexual dysfunction at some point in their journey through Parkinson's. And overall, just in general, right, in the United States, sexuality is very much underappreciated. And we don't think about it as being kind of who we are as a person also. We talked about, again, dopamine and its importance too with sexual functioning as well. Again, here's the big with the movement, and there's going to be physical limitations that go along with that too. So again, positioning, being able to prop, use pillows, being able to make sure that pain, right? Pain can definitely happen too, and troubleshooting that as well. There is sometimes a big overlap between being a caregiver, right? That caregiver a lot of times is the partner. And how do you separate out being a caregiver from a partner? And we'll talk about definitely some tips and tricks that we can do to make this better also. There can be lots, again, like a lot of frustration, right? And grief and loss that goes along with this too. Not only are you losing a lot of your physical abilities, again, those autonomic pieces that go along with Parkinson's, it's your identity, your sexual identity. And that was when I talk to a lot of my patients with Parkinson's, I mean, they're pissed, they're upset, and that they've lost this part of it and that no one has talked to them about it. So we talked to neurologists, and I talked to a lot of my neurologists here in the area for various reasons. They don't think about bringing this conversation up. I don't know how many of you all with your providers, if anybody has actually brought up the topic of sexuality and how that feels in that relationship. And I would say very few, yeah, I'm here seeing people shake their heads. People aren't bringing it up, right? But it's a huge important part of who you are. And again, like I said, your identity. When we think about the barriers to sexual health and having those conversations, almost 3/4 of patients want the provider to bring up that conversation, that they feel like it's a huge, important part of it. But when the provider doesn't bring it up, that's an automatic assumption that then maybe sexual health isn't important. And so again, there's just this back and forth. So really, it's got to be me as that caregiver, right, to bring that up and to be an advocate, to say, hey, Parkinson's can sometimes affect sexuality. Are you all finding that that's impacting your life right now? It's a simple question. And I think a lot of times too, it's people don't want to bring it up because they don't know how to answer it. Again, we don't have a lot of research and data out there, or trainings in their medical trainings to have these conversations. But again, like really important to have those conversations. Limitations, again, or cessation of sexual activity can cause, again, these increased emotions that are going on as well. And again, just a lot of frustration there too. And then we talked about some grief and loss there also. Okay, so we talked about, kind of the percentages here, and it's very varied based off of the type of research that you're seeing. But I would say, and I'm biased because this is what I do, I would say that, again, it's closer to that 75 to 80% of individuals that have Parkinson's have these following difficulties, right? Decreased satisfaction, they may have pain with intercourse or penetrative activities. Again, because of that autonomic reaction, premature ejaculation can happen too. So quickness of orgasm can happen. Impaired sexual coordination, again, with that movement that we're seeing as well. A lot of times we see erectile dysfunction, and it's not just secondary to Parkinson's. It's some of the medications that you're being put on. If there are other comorbidities that are impacting you too, someone who has high blood pressure or has diabetes, those types of medications can impact the erectile function as well. And then on those that are vulva owners or females, a lot of vaginal dryness. And this can be secondary to menopausal concerns also. But again, that autonomic response, you're not getting the signals to those genital tissues to create moisture and lubrication from happening. And then again, we know with the loss of dopamine, it's the libido is gone. I hear this so often, and it's so frustrating because even, I ask them, who would be your celebrity crush? And if that celebrity crush walked in the door and said, let's have a really good makeout session, or let's get naked, there's not even this desire to even be with that celebrity crush. So it's just a loss of libido and motivation, kind of overall. And it's then super frustrating for that individual that has Parkinson's, because they see their partner, and maybe their partner is wanting to be sexual and have more intimacy. And again, this disconnect that's happening within that relationship as well. And then obviously, again, on that autonomic type of side too, with the nerve sensitivities that are happening, you need all of that to reach that threshold for orgasm to happen also. And when talking to patients, there's a lot of frustration when you can feel some arousal and you have some sexual activity, but right, we want that positive feedback that's happening there also. On the other side of things too, again, with those medications, if dopamine is increased, we see more of this hypersexuality that can happen there too. And that can be sometimes, I've heard partners say, offensive, that some of the comments that are being made or the groping that may happen as a partner, right? There's going to be this, again, disconnect about what's okay. When we talk about judgment too, and that loss of judgment can happen also. So again, things to think about and have those conversations and with your provider. But again, these are some things that, again, me in the medical community, we need to be bringing these up. And then we've talked about urinary incontinence also. And yeah, I've got a comment, right, that even just gynecologists have trouble bringing up the conversation of sexual health in just a regular health appointment. I can't tell you just how many times I hear that over and over again. My medical provider just doesn't even want to, bring it up. And it is a matter of quality of life. Absolutely. And we need to be having more conversations and normalizing those things as well. Let me make sure there's no more questions or comments. Yeah. Everybody following so far? We all good? Yeah. Okay. So the psychological factors are going to be really important for us to talk about too. When we think about right body image, again, that grief and loss when it comes to seeing ourselves in a different light now, feeling very frustrated that our bodies aren't working the way that we want them to. So we talked again about motor problems, right? If there is excessive saliva that the Parkinson's person is experiencing, that can be sometimes a turn off for some individuals if you're wanting to kiss or have some sort of oral type of interaction. Again, we talk about like the swallowing properties of it as well. And then a lot of dependency, right? You're in total dependency of your caregiver, which again, a lot of times is your partner, and being able to, again, separate the fact of bowel and bladder movements and helping them to the bathroom and cleaning them off. So now looking at those genitals as a sexual type of thing versus a functional type of thing. So being able to do that can be really frustrating. If there's been loss of speech or difficulty with language or cognitive, meaning being able to process kind of what's happening within the brain, sometimes those cues that we would normally give our partner in the past to say, hey, I'm feeling a little frisky, they may not register to them anymore. So we may have to be more direct, may have to give them more cues on and direction on what's going on there also. We talked about like sexual passivity, again, associated with those motor difficulties, depression, anxiety are huge there, right? Trying to avoid any kind of sexual activity. And then again, hypersexuality too, we talked about this a little bit also, and how sometimes that can be very offensive to that partner. And then the patient or the person with Parkinson's isn't aware of that either. I love it. You all are just giving me lots of questions. I've got, what are the best ways to communicate with your partner? And then, yeah, when is counseling recommended? So one of the best ways to communicate, and this is what I recommend to everybody, is be direct. Say exactly what you are wanting to happen. So, and it sounds kind of crazy, but I recommend this to all of my patients who are struggling with their partner understanding what their needs and wants are. So be very direct. And sometimes, again, that can be very difficult for those that are going through the Parkinson's disease of being able to really communicate. So when communication, I think across the board is something that we lack as a country and that we need to be doing much better on. But one of the things that I really recommend for a lot of my patients to do is to, if they can't say it verbally, to write down specifically what they are wanting. We talk in circles and we aren't direct in what we exactly want. And if the person that again is going through Parkinson's is saying something to you, being able to say, this is what I'm hearing. Is this what you want me to do? And asking those questions for validation and for clarification as well. So again, being able to actually say, being very direct. And totally, writing is a huge challenge for a lot of Parkinson's individuals. And so, computers can be really difficult. Even if they can say kind of one word at a time, or being very patient with those individuals. And even if they can, I know some fine motor, being able to write is difficult. So even just kind of trying to grasp something, a writing utensil in your hand, you can use some sort of band to hold onto it if they're having difficulty being able to grasp that. Get a big whiteboard can be really helpful too, in order for them to make big movements to help write out what they are needing. And this is a lot of times too, when you catch Parkinson's early, these conversations need to be talked about way ahead of time, so that when loss of speech or loss of dexterity is a concern, we're already being able to communicate and understand that this word means this, or I'm going to point to something and this is what I want. So you may have to be, as the partner and caregiver, patient for sure is going to be really important. But then, being able to help to differentiate what are they trying to mean. And you can always take a break, is what I tell people. Don't get so frustrated in one sitting and say, I think for both of us right now, let's take a break. Let's take a break for an hour or two. Let's come back and have that conversation as well. So those are some of the tips that you can utilize there. Depression. Depression is huge. And I think that we've definitely seen that over the past 18 months, right, from the pandemic, is that mental health is huge. And mental health, not just for patients, but for those that have chronic illness as well. This has been going on for a really long time. And we know that, around half of, again, Parkinson's patients, again, the depression is around the sexual part of it. So it's not just necessarily that they don't have the motor skills or the verbal skills anymore. It's, again, this loss of sexual function that's causing a lot of that depression and anxiety and mood changes. The other thing too is, if we're treating the depression, these antidepressants also cause sexual concerns. So now we have a double whammy on here, which can make it even more difficult and frustrating. So what can we do about it though? Obviously, talking to the provider who's prescribing your medication, see if you can lower the medication. Can always be an option. If you can take what we call like a drug holiday. So like on weekends, when you know that maybe sexual activity is going to occur, trying to avoid taking the medication there, again, with safety. And I recommend everybody talk to their medical providers before they implement any of this. Adding a medication called bupropion or Wellbutrin can be really helpful. This one has been studied for a long time to improve sexual functioning, and has been an antidepressant, anti-anxiety medication for a long time too, as well as Buspar is another one. Now you may say, why in the world, Elise, did you have adding sildenafil or Viagra here? Because what does Viagra do? Viagra brings blood flow to those genital tissues. It doesn't have anything necessarily to do with lowering the libido like some of these antidepressant medications can do. But we know that increasing arousal and the ability for erections to happen, or for women to have genital engorgement, that can help as a turn on for those individuals as well. And then here I talked about, switching different antidepressants to, not just adding, can be really helpful. So some of these other medications have less sexual side effects, not none, but just less sexual side effects. We talked about holidays, and then making sure that we are using what we call enough physical stimulation. I use this term responsive desire. Oftentimes we want somebody to make that move, right? Or be receptive of it. So one of the things that I recommend to several of my patients is to think about how your body is responding to physical touch, to any kind of hug or kiss. What is it that's starting to go? You may not have desire that's going on right there in your body, but once some physical touch starts to happen, then that's when some of that desire and libido may start to happen there as well. Good question. What would happen if women take Viagra? So I prescribe sildenafil or Viagra for female patients all the time. It works the same way. So when we think about penile tissues and clitoral tissues, they're homologous in erectile tissue. Both fill with blood during sexual arousal. And you need enough of that arousal to happen, again, to hit that threshold where orgasm can actually happen. So for my women that have restrictive blood flow, that have had hysterectomies, who are going through menopause, they've lost a lot of that blood flow to the genitals. So one way I can help that out is by prescribing it. I don't do as high of dosage of the sildenafil for my female patients. When you think about the size of penile structures versus the clitoral structures, although the clitoris is not that much smaller than the penile tissues, because what you don't see is all internal with the clitoris. It looks like a wishbone. I actually have one here. I'm going to make sure. I mean, that's funny, right? So if you can see, so this is actually what the clitoris looks like for women. What you see is kind of just this outside structure is all that we typically see. And that's just the glands of that clitoris. All of this is inside. Here, between this opening is where the urethra is up here at the top, and then the vagina is here. So all of these structures are internal. So it looks like a little wishbone, right? And again, when this swells and gets aroused, it's almost the same size of an average size penis, which is so crazy to think of, but it really is that big. So again, definitely can be very helpful for female patients as well. Sometimes if oral medications, oral sildenafil doesn't work as well, or you have side effects with it, we can always use topical and use that in a compounded as well. Great question. Love that question. Okay, so what can you do, right? So here's the big takeaways for you all. One of the things we talked about open communication, right? We've talked about this a lot, being very direct, being very specific with the types of things that you are wanting to look for. It may feel very uncomfortable at first. One of the things that I do with some of my patients, whether they have Parkinson's or they're the partner or the caregiver, is we role play. I role play with them and say, let's practice. The more that you practice, the more comfortable you are with saying, I need to have sexual penetration. Let's see when can we schedule some time to actually do that. Or I need you to touch my shoulder here. So being very direct in where you're wanting and with what you're wanting and where you're wanting it to. Practicing comfortable positions. And obviously, if something is starting to become painful or uncomfortable, changing positions when needed as well. I love using props. Liberator is a company that has pillows and foam pads that you can use to help make you as comfortable as possible. So that's one of the things too. Making sure too that you have everything that you need nearby. So if that means you need to have some baby wipes nearby, you need to have some lubricant nearby, food, water, whatever it might be that you might need, because what happens is you don't want to break that connection that you are making during that sexual encounter. The longer, like if you had to go into the other room and get the baby wipes or get a washcloth, whatever it might be, you're going to lose some of that connection. So having everything that you need right at your fingertips can be really important to continue to keep that connection. Sometimes we may have to adapt new roles based off of abilities. In typical situations, what I see and what I hear is that the male partner is usually the initiator. If that male partner is the one who has Parkinson's and they're not initiating that may be where the female partner has to kind of pick that role up and start the initiation more. Again, all in a consensual type of relationship. Finding new solutions for physical limitations, touch. And this is where too, because of the autonomic nervous system and how nerve endings are being received from touch, the earlobe may be a more arousing place on someone's body to touch them. Underneath the clavicle may be another one. So again, thinking about all of these different things that can really help to increase that sensation. Again, we focus so much on genitals as being the thing that wraps around sexual intimacy, but that is not the case. And penetration and what we call, sexual intercourse are going to be those things that's just the tip of the iceberg. There's so many other things that you can do, and being able to really use this to refocus your goals. We talk a lot about just what's intimacy versus sexual activity, and refocusing on the connection and what that pleasure actually looks like versus being so much like orgasm focused. and what we thought about, again, what that gold standard of is here in the United States, which is, penis and vagina intercourse. But again, it's much, much more than all of that. One of the exercises that I give to some of my patients is an exercise called a sensate focus. This was developed by Masters and Johnson back in the 1960s, who are kind of our main researchers when it comes to sexual health and that sexual response cycle. But what sensate focus it does is it helps as a process of relearning, again, those body sensations. And if somebody is interested in that, and Lauren, I can definitely give you all a handout that you can share with people also. It's a step-by-step guide that refocuses on touch, right? So touch so much has been on genitals or breasts, but really refocusing on touch around the face, around the hands, the shoulder, the feet, the knees, working on all of those to, again, relearn what maybe some of those body sensations are and what feels good for you now. Exploring new horizons. I think Tantra practice is great, being able to really explore the energy that somebody brings into that sexual encounter. And so again, it's just another way to form some connections with you and your partner that are outside that caregiver mindset and what's happening most of the time on a daily basis. BDSM is more of a umbrella term that could include some activities like bondage, so using something to hold arms. This can be really helpful if somebody is having some movement difficulties where we need to stabilize maybe an arm or stabilize a leg. That can be really helpful. Again, learning all of those body sensitivities that sometimes a little light, what am I trying to say? Gosh, I'm not trying to think of how I want to actually say that. So using like more of like either spanking or using just some light kind of tapping can be another way to do that, to increase sensation if there's been loss of sensation. Toys are a great way. Vibrators are one of the things that I recommend a lot to my patients. It's going to help to increase sensation and being able to get somebody up and over that threshold. Or it might be helpful to bring more blood flow to those genitals as well. So again, all of those things can be really a way to open up with that. Somebody commented on massage. Massage is another great way as a connective piece for you to connect with your partner also. I love massage. Uberlube, which is a silicone-based personal lubricant, also doubles as a massage oil. So that can be a great thing for a 2-for-1, essentially, that you can be able to rub on your body, on your partner's hands, back, genitals, all of those types of things can be really helpful for that. I love, love, love massage. And we forget that sometimes that can be a way to increase intimacy as well. So thank you for that message. Some more things that you can do, focusing on the partner, whether that is the person with Parkinson's or not. There is a lot of times so much focus on us as the individual. Well, how, especially the one that has Parkinson's, how's my body going to move? How am I going to be responsive? Am I going to accidentally leak urine? Like all of those types of things. So it can be really difficult to change that mindset. But once you start looking at your partner and focusing on them, no matter, again, caregiver partner or the person that has Parkinson's, that can be really key to getting out of your head and getting more present in the moment when you're focused on that partner. And then plan. I get a lot of resistance when I talk about this a lot of times, because when I say to plan it and to schedule it, it loses that spontaneity. Well, when you were younger and your partner said, hey, do you want to go out this weekend? You were already kind of thinking and planning in your head, well, what if something kind of intimate happened? So you might have shaved your legs, you might have shaved your face, you might have picked out a new outfit. You planned that, even though it felt spontaneous, there was still more some planning that actually went along with it. But just like we talked about, having everything at your fingertips during that sexual activity, that's just going to be really important in order to pull in and keep that connection there too. There's also some excitement that if you know that you've scheduled this intimacy time to have connection, that it's exciting what's going to happen. That buildup is going to be another thing to help you on that sexual side of things. Excuse me. And then planning, obviously, weekends away and vacations. I understand that that's going to take a lot more planning for that too. But sometimes when you take yourself out of the everyday situations and settings, excuse me, that can be really helpful to make it not so normal and mundane, and where, again, all of that caretaking is happening, but it's someplace different, can be helpful. And then obviously too, thinking about hiring somebody to have respite care for those that are the caregiver partners, and then definitely talking to mental health providers and having some counseling or therapy for individuals and couples. I have a really good colleague of mine, and I'm blanking on his name is Lee. Why can't I remember? I'll send you the link and the resource. He is definitely, he's a sex therapist, and really focusing on chronic illness and chronic disease impacting sexual function. And one of his things that he really researches on is Parkinson's, and being able to have resources for those individuals and normalizing that these, again, are conversations that we should be happening. One of the questions that came through was thoughts on the role of masturbation for Parkinson's patients and partners. Absolutely. So mutual masturbation, is definitely one thing that I recommend. So touching genitals. Sometimes penetration may not be able to happen because of erection issues or pelvic pain, maybe another one. And so being able to kind of take that off the table and focus just on external stimulation or just genital rubbing can be another one. When we talked about that sensate focus exercise earlier, one of those levels of exercises is to start touching the other person's genitals. And again, how does that feel? Again, making sure that we're using words, that everything is very consensual, and that both parties are engaging in it. If one partner is not interested in partnered sexual play, knowing that having masturbation in your back pocket or self-stimulation can be another way to keep that intimacy. Again, it may be that it's difficult for you all to engage together, but one person may want to watch their partner masturbating or self-pleasuring, and vice versa. So it's being able to just open up your mind and being really creative, and that there's no limits on this. It's whatever works the best for you and your partner goes. And if it feels good and everybody is safe, then it's totally fine. Oh, that was a lot of information in a short amount of time, but I wanted to make sure that I left enough time for questions. And I really appreciate you all being so involved in the chat and sending me questions. So the biggest thing, though, that I really want you all to understand is that sex is important. Your sex and sexuality and sexual identity is really important too. And finding providers and people that can be there and be very helpful. And I will send out another list of ways that you all can find resources. I should have, I don't think that, no. Yep, I didn't put that on there, but I'll get you all a resource list so that you know how to find somebody in your area. I recognize too, like limitations and access to Asheville if you're not in the area, because there's lots of providers down in the Greenville area also.
Well, and that is something I wanted to say too. Yeah, at least if you can just send me, and certainly your contact information I have, but to everybody on the call, I will make sure that we have all of that for you to send out so that you can continue this conversation if that's something that you'd like to do. And I think that the most important thing that I heard you say, and you said a lot of great things, is really just to have the conversation. I think that is something that people don't want to have. As my children are 19 to 24. And so I've, recently been in the conversation with lots of other parents, like, oh, I don't want to talk to my kids about sexuality. I was like, well, that's really not a good plan. So whether you're talking about teenagers or you're talking about married couples, or you're talking about people with, other challenges, the physical challenges of Parkinson's, it's not something that we talk about comfortably. And that's a shame, because everybody feels like with so many things, you suffer in silence. You're the only one. You're the only one that's thinking about these things. You're the only one that has these questions or these problems. And it's so helpful just to open up that conversation. I think for that reason, Elise, I'm so grateful that you were willing to take the time with us today. Do you have any other questions in your chat, or if there's anybody else that has a question that they would like to pose before we head off today? Or comments?
And you all have my email too. So even, I've planted some seeds for you all today. And I'm hopeful that you all will take some of that information and process it and be able to think about, and again, reflecting on how it feels for you as an individual too, and for you within your relationship. And if there's some questions or even comments that come up, you all have my email. And Lauren, like I said, I'll definitely give you that resources list also, so that everybody knows where they can go to get some extra information.
Certainly. And if there are, conversations you'd like to have, people would like to have with you, make sure that they can reach out and continue if there's more things that want to be talked about. But again, thank you. Thanks all for participating. As Elise said at the beginning, being brave enough to have this conversation, because some people are uncomfortable. And I think that that's a shame. So I'm glad that you were here. But for everybody else, we're going to share the information. And Elise, I look forward. I hope someday I can meet you in person.
Vice versa. Yes, absolutely.